Marburg Virus Disease, or MVD, is a serious illness. It often leads to death. The virus causing MVD is related to the Ebola virus. Both cause hemorrhagic fever. Hemorrhagic fever means that patients experience bleeding internally and externally. MVD has a high fatality rate, meaning many infected people die. There is no cure for MVD. However, early treatment can improve chances of survival. This essay will explain MVD, its transmission, symptoms, and prevention. It will also discuss the importance of ongoing research. The Marburg virus was first identified in 1967. It was found in Marburg, Germany and Belgrade, Serbia. Scientists traced the virus back to African green monkeys imported from Uganda. These monkeys carried the virus. The natural host of the Marburg virus is the fruit bat. The virus lives in these bats without causing them harm. The virus can spread from bats to other animals, including humans. Once in humans, the virus can spread from person to person. Humans can get infected with the Marburg virus through contact with infected animals. This can happen through direct contact with the animal's blood or bodily fluids. It can also happen through contact with contaminated surfaces or materials. Once a human is infected, the virus spreads through direct contact with their bodily fluids. These fluids include blood, saliva, vomit, and feces. The virus can also spread through contaminated needles and medical equipment. The incubation period for MVD is typically 2 to 21 days. This means that it can take up to 3 weeks after exposure for symptoms to appear. Early symptoms of MVD are similar to other diseases like malaria or typhoid fever. These symptoms include high fever, severe headache, muscle aches, and fatigue. As the disease progresses, more severe symptoms appear. These include nausea, vomiting, diarrhea, and unexplained bleeding or bruising. In fatal cases, death usually occurs 8 to 9 days after symptoms start. Diagnosing Marburg virus disease can be difficult. This is because its initial symptoms resemble other diseases. Doctors must consider the patient's travel history and possible exposure to the virus. Laboratory tests are essential for confirming Marburg virus disease. These tests include ELISA, antigen capture tests, RT-PCR, and virus isolation. These tests detect the virus or its components in the patient's blood. Section 6. Treating MVD, supportive care and experimental therapies. Currently, there is no specific treatment for MVD. This means that healthcare providers must focus on managing the symptoms and complications of the disease to improve patient outcomes. No antiviral drugs or vaccines are available. Researchers around the world are working tirelessly to develop effective treatments and preventive measures, but as of now, supportive care remains the cornerstone of managing MVD. However, providing supportive care is crucial for improving a patient's chances of survival. Supportive care includes rehydration, which involves giving fluids to prevent dehydration caused by fever and diarrhea. This is essential because dehydration can lead to severe complications and even death if not properly managed. Giving fluids to prevent dehydration caused by fever and diarrhea. Electrolyte balance is another critical aspect of supportive care. This involves maintaining the balance of salts and minerals in the body, which can be disrupted by severe vomiting and diarrhea. Maintaining the balance of salts and minerals in the body, which can be disrupted by severe vomiting and diarrhea. Oxygen therapy is also an important component of supportive care, which can be disrupted by severe vomiting and diarrhea. Oxygen therapy, providing oxygen if the patient has difficulty breathing. This can help ensure that the body's organs receive enough oxygen to function properly. Providing oxygen if the patient has difficulty breathing. Blood transfusions are another vital part of supportive care. These are necessary if the patient has severe bleeding, which can occur in advanced stages of MVD, giving blood transfusions if the patient has severe bleeding. In addition to these supportive measures, experimental therapies are being explored. These include the use of monoclonal antibodies, antiviral drugs, and other innovative treatments that are currently in various stages of research and clinical trials. While these experimental therapies offer hope for the future, they are not yet widely available and are still being tested for safety and efficacy. Until then, supportive care remains the best approach to managing MVD and improving patient outcomes. Section 7. Prevention and control measures for MVD. Preventing MVD requires a multifaceted approach. This means that a combination of strategies and actions must be implemented to effectively reduce the risk of transmission and control the spread of the virus. It is not enough to focus on just one aspect. A comprehensive plan that addresses various factors is essential. One of the primary measures involves reducing the risk of transmission from animals to humans. This is crucial because the Marburg virus is known to be carried by certain species of fruit bats, which are considered the natural reservoir of the virus. By minimizing contact with these animals, we can significantly lower the chances of the virus jumping from animals to humans. Another critical aspect is preventing human-to-human transmission. This can occur through direct contact with the bodily fluids of an infected person or through contact with contaminated surfaces and materials. Therefore, it is important to implement strict hygiene and sanitation practices, as well as to educate communities about the ways in which the virus can spread. Here are some key prevention measures. Avoid contact with fruit bats. This includes not only avoiding direct contact with the animals themselves, but also staying away from areas where they are known to roost or feed. For example, fruit bats often inhabit caves and certain types of trees, so it is advisable to steer clear of these locations. Bats are the natural reservoir of the Marburg virus. This means that they carry the virus without showing symptoms and can transmit it to other animals or humans. Understanding this helps us to take appropriate precautions when in areas where bats are present. Avoid entering caves or areas where bats are known to live. Practice safe food handling. This includes ensuring that food is stored properly to avoid contamination, and that it is prepared in a way that kills any potential pathogens. For instance, cooking meat thoroughly is a key step in preventing the transmission of the virus. Cook meat thoroughly, especially bushmeat, to kill any potential viruses. Maintain good hygiene. This means washing hands regularly, especially after handling raw meat or coming into contact with animals. Using soap and water is essential as it helps to remove any traces of the virus that may be present. Wash hands frequently with soap and water, especially after handling animals or their bodily fluids. Isolate infected individuals. This is crucial in preventing the spread of the virus to others. Isolation helps to contain the virus and reduces the risk of it spreading within the community. People with MVD should be isolated to prevent the virus from spreading. Use personal protective equipment. This includes wearing gloves, masks, gowns, and eye protection when caring for infected individuals. These measures help to protect healthcare workers and others who may come into contact with the virus. Healthcare workers should wear gloves, gowns, masks, and eye protection when caring for infected patients. Safe burial practices. This is important because the virus can still be present in the bodies of those who have died from MVD, and improper handling can lead to further transmission. Bodies of people who have died from MVD should be handled with care and buried safely to prevent further transmission. This includes using protective equipment and following protocols to ensure that the virus is not spread during the burial process. By taking these measures, we can help to control the spread of MVD and protect our communities. Section 8, the World Health Organization's role in MVD outbreaks. The World Health Organization, or WHO, plays a vital role in responding to MVD outbreaks. This global health agency is responsible for coordinating international efforts to combat the spread of infectious diseases, including the Marburg Virus Disease, MVD. The WHO's involvement is crucial in ensuring that outbreaks are contained and managed effectively. WHO works with countries to strengthen their capacity to detect, investigate, and respond to outbreaks. This involves providing technical support and resources to local health authorities, ensuring they have the necessary tools and knowledge to handle the situation. Training local health workers is a key component of this effort, as it helps build a sustainable response system that can be activated quickly in the event of an outbreak. WHO's response to MVD outbreaks includes surveillance, monitoring for cases, and tracking the spread of the virus. Surveillance activities are essential for early detection and timely intervention. By closely monitoring health data and conducting field investigations, WHO can identify new cases and potential hotspots, allowing for a targeted response. Laboratory support, providing laboratory testing to confirm cases and identify the virus. Accurate and timely diagnosis is critical in managing MVD outbreaks. WHO supports the establishment of mobile laboratories in affected areas, enabling rapid testing and confirmation of suspected cases. This helps in isolating infected individuals and preventing further transmission. Contact tracing, identifying and monitoring people who may have been exposed to the virus. Contact tracing is a vital part of the response strategy as it helps to break the chain of transmission. WHO teams work diligently to trace and monitor contacts of confirmed cases, ensuring that they receive appropriate care and are isolated if necessary. Case management, providing guidance on the clinical care of infected individuals. Effective case management is essential for improving patient outcomes and reducing mortality rates. WHO provides protocols and guidelines for the treatment of MVD patients, ensuring that healthcare providers are equipped with the best practices for managing the disease. Risk communication, sharing information about the outbreak and prevention measures with the public. Clear and accurate communication is crucial in managing public fear and misinformation. WHO engages with communities to provide updates on the outbreak, educate them on preventive measures, and promote behaviors that reduce the risk of infection. This helps to build trust and cooperation between health authorities and the public, which is essential for a successful outbreak response. Section 9. Conclusion: the ongoing threat and future research. Marburg virus disease remains a serious public health threat. Its high fatality rate and lack of specific treatment make it a global concern. Prevention, early detection, and rapid response are crucial for controlling outbreaks. Ongoing research is essential for developing effective vaccines and antiviral drugs. Research is also crucial for understanding the virus's behavior and improving diagnostic tools. By investing in research and public health measures, we can work towards a future where MVD is no longer a threat.